Living with diabetes means you're already carefully managing so many aspects of your health. But there's one crucial factor that often flies under the radar, and that's vitamin B12 deficiency. It's actually surprisingly common among folks with both type 1 and type 2 diabetes, yet it's frequently overlooked. So understanding this link is really key to comprehensive diabetes care. Top 5 facts about vitamin B12 and diabetes. So, let's dive into what you need to know about the connection between vitamin B12 and diabetes, and how it could be affecting you or your loved ones. Number 1. Prevalence of B12 deficiency in diabetics. First off, it's important to realize that a significant number of individuals managing diabetes also contend with vitamin B12 deficiency, and this is a reality that often goes unnoticed. In fact, studies reveal a high prevalence of both biochemical and clinical vitamin B12 deficiency among patients with both type 1 and type 2 diabetes. Now, biochemical deficiency simply refers to low levels of B12 in the blood, while clinical deficiency means the person is also experiencing symptoms. And when you compare them to the general population, diabetic individuals actually show considerably higher rates of B12 deficiency. This difference really highlights a specific vulnerability within the diabetic community that definitely warrants attention from both patients and healthcare providers. It really underscores the need for increased awareness and proactive screening. Now, understanding what actually constitutes a deficiency is crucial. Clinically speaking, a vitamin B12 level below 148.0 picomoles per liter, PMOLL, is generally considered a deficiency. However, it's interesting that some individuals may experience symptoms even at slightly higher, borderline levels, which can make diagnosis a bit of a nuanced process. The good news is, early detection can prevent more serious complications. Number 2, Metformin, the primary culprit. All right, moving on to our second point. For many people managing type 2 diabetes, Metformin is a cornerstone of treatment, and it's renowned for its effectiveness in controlling blood sugar levels. However, one of the less discussed yet pretty significant aspects of Metformin use is its potential to actually induce vitamin B12 deficiency. This connection is really critical for both patients and doctors to understand. You see, the development of decreased vitamin B12 levels is now recognized as a relatively common side effect associated with metformin therapy. This isn't some rare occurrence. Rather, it's a predictable consequence for a portion of individuals using this medication, especially over extended periods. So, just being aware of this side effect is the first step towards managing it effectively. What's more, research indicates a dose-dependent relationship between metformin and vitamin B12 levels. This means that individuals taking higher doses of metformin are generally at a greater risk of developing lower B12 levels. So the more metformin that's prescribed, the more vigilant you need to be about your B12 status. Furthermore, the duration of metformin use also plays a significant role. Long-term administration of the drug substantially increases the likelihood of vitamin B12 deficiency. So patients who have been on metformin for several years should be particularly mindful of this risk and make sure to discuss regular monitoring with their healthcare provider. Number 3, the connection to diabetic neuropathy. Our third key fact revolves around diabetic neuropathy. Now, diabetic neuropathy, which is a type of nerve damage, is a common and often debilitating complication of diabetes. And emerging evidence strongly suggests there's a correlation between vitamin B12 deficiency and the presence or severity of this diabetic neuropathy, which adds another layer of complexity to diabetes management. Some startling statistics really highlight this link. Approximately 64% of patients diagnosed with diabetic neuropathy also exhibit altered vitamin B12 levels. That's a high percentage, and it suggests that B12 deficiency could be a significant contributing factor or perhaps an exacerbating element in the development or progression of nerve damage in diabetic individuals. It also appears there's an inverse relationship between vitamin B12 levels and the severity of neuropathy. What this means is that as B12 levels decrease, the symptoms and impact of neuropathy tend to become more pronounced. So maintaining adequate B12 levels could therefore be crucial in mitigating the severity of nerve damage. And this is crucial. The symptoms of vitamin B12 deficiency, things like numbness, tingling, and weakness, can actually mimic or worsen those of diabetic neuropathy. This overlap can make it quite challenging to distinguish between the two conditions. This could potentially lead to misdiagnosis or an overlooked B12 deficiency, which would then delay appropriate treatment and relief. Number 4, risk factors and vulnerable groups. Let's move on to risk factors and vulnerable groups. While we've talked about metformin use being a primary driver, several other factors can influence an individual's susceptibility to vitamin B12 deficiency in the context of diabetes. Certain demographic and clinical characteristics can heighten the risk, making some groups more vulnerable than others. Interestingly enough, some studies have pointed towards potential gender differences. It seems men sometimes exhibit lower average vitamin B12 levels compared to women within diabetic populations. Although this isn't universally conclusive, it does suggest that male patients might warrant closer attention regarding their B12 status. The type of diabetes you have may also play a role in B12 deficiency patterns. While metformin-induced deficiency is predominantly associated with type 2 diabetes, individuals with type 1 diabetes are not immune. This is especially true if they have coexisting autoimmune conditions like pernicious anemia, which impairs B12 absorption. Also, the duration for which an individual has lived with diabetes can impact their B12 levels. Longer-standing diabetes, regardless of the type, may increase the cumulative risk. This is due to various physiological changes, dietary restrictions, or associated complications that can affect nutrient absorption and status. And finally, the use of other medications, such as proton pump inhibitors, or PPIs, which are commonly used for acid reflux, can further impair vitamin B12 absorption. If you have coexisting conditions like celiac disease or inflammatory bowel disease, these can also compound the risk. So, it's really essential to consider the whole clinical picture. Number 5, testing and diagnosis considerations. Our 5th point deals with testing and diagnosis considerations. Given the heightened risk we've discussed, knowing when diabetic patients should be tested for vitamin B12 deficiency is paramount for proactive care. Regular screening is particularly recommended for individuals on long-term metformin therapy, those who are exhibiting symptoms of neuropathy, or those with unexplained anemia or cognitive changes. There are several types of tests available to assess vitamin B12 status. The most common one is a blood test that measures serum B12 levels, and this is often performed using something called a chemiluminescence immunoassay. In some cases, doctors might also test for methylmalonic acid, or MMA, or homocysteine levels, as these can be elevated when B12 is deficient, even if the serum B12 levels are in the low normal range. Now, diagnosing vitamin B12 deficiency isn't always straightforward. Borderline B12 levels can present a real clinical challenge because some individuals may experience deficiency symptoms even when their lab values aren't classically low. On top of that, the symptoms of B12 deficiency, like fatigue, weakness, tingling, and memory issues, can overlap significantly with symptoms of diabetes itself or its complications. This makes careful assessment absolutely crucial. Because of all this, recommendations for the frequency of monitoring are evolving. For patients on metformin, annual screening for B12 deficiency is increasingly advised by various professional organizations. For other at-risk groups, the frequency really should be determined by their healthcare provider based on individual risk factors and their clinical presentation. Treatment approaches. So, what happens if a vitamin B12 deficiency is diagnosed in a diabetic patient? Well, the good news is that several effective treatment approaches are available to restore adequate levels and alleviate symptoms. The choice of treatment often depends on how severe the deficiency is, what the underlying cause is, and of course, patient preference. The primary treatment options usually include oral vitamin B12 supplementation and what's called parenteral or injection therapy. High-dose oral supplements are often effective for many individuals, even those with some absorption issues, because a small percentage is absorbed passively. On the other hand, injections, typically hydroxycobalamin or cyanocobalamin, are often preferred for severe deficiency, significant malabsorption issues, or when a rapid increase in B12 levels is needed. Now, dosage recommendations can vary quite a bit. For oral supplementation, doses often range from 1,000 to 2,000 micrograms (mcg) daily. Injection schedules might start with frequent doses, say weekly, e.g., weekly, to build up stores, and then that's followed by less frequent maintenance injections, perhaps every 1 to 3 months, e.g., every 1 to 3 months. Your doctor is the one who will determine the appropriate dose and route for your specific situation. The duration of treatment really depends on the cause and severity of the deficiency. If the cause is reversible, like a metformin-induced deficiency that resolves with supplementation, then the treatment might be finite. However, for conditions like pernicious anemia, lifelong maintenance therapy is usually necessary. It's good to know that both oral and parenteral treatments have been shown to be effective in correcting vitamin B12 deficiency and improving related symptoms. The absolute key here is early diagnosis and consistent adherence to the prescribed treatment plan to ensure those B12 levels are normalized and maintained. Prevention strategies. Let's talk about prevention. Preventing vitamin B12 deficiency, particularly in high-risk diabetic individuals, is a really important aspect of comprehensive diabetes management. Taking proactive measures can help maintain adequate B12 levels and avert the potential complications that are associated with its deficiency. For patients who are considered at high risk, like those on long-term or high-dose metformin, prophylactic vitamin B12 supplementation may be a prudent strategy. It's a good idea to discuss this preventative approach with a healthcare provider to determine if low-dose daily oral B12 is appropriate for you. Now, while dietary sources are important, it's true that for diabetics at risk, especially those on metformin, diet alone may not be sufficient to prevent deficiency due to those absorption issues we talked about. However, including B12-rich foods like lean meats, fish, poultry, eggs, and dairy products, or fortified foods, still remains a good general nutritional practice. It's also essential to establish clear monitoring protocols for patients taking metformin. Regular B12 testing allows for early detection of declining levels, and this enables timely intervention before a clinical deficiency and its symptoms actually manifest. This kind of proactive screening is definitely becoming a standard recommendation. And finally, recent changes in clinical practice guidelines are increasingly emphasizing the need for B12 monitoring and management in diabetic patients, especially those on metformin. Staying informed about these guidelines helps both patients and healthcare providers address this issue much more effectively. So, to wrap things up, the connection between vitamin B12 deficiency and diabetes is truly undeniable, and it carries significant implications for your health. Awareness, regular testing, especially if you're on metformin or experiencing neuropathy, and appropriate treatment are all vital. This often overlooked issue really deserves far more attention in routine diabetes care to help improve overall well-being. Now, if you found this information helpful, please consider sharing it with friends or family members who are living with diabetes. And perhaps consider discussing vitamin B12 testing with your healthcare provider at your next appointment, particularly if you take metformin or have symptoms of nerve damage.